Chatham Minister of Health, Dr. Karen Cummings, who was at the time speaking at a virtual press conference on Wednesday, said the government's decision to have more than 800 positive persons in home isolation is contributing to the steep rise in cases. She opined that with a lack of effective surveillance to effectively monitor these individuals, the government is relying on false hope that every 10 persons with coronavirus in Guyana will stay safely at home and adhere to the COVID-19 guidelines. Dr. Cummings estimates that the government saves approximately $24,500 a day for every person that is allowed to home isolate. She's maintaining that patients should be supported with care packages until their isolation period is over.
You have to ensure that they have the sufficient masks to change at home. You want to ensure that how they're disposing of their infectious waste. In terms of the bin liners, you'll have to give them bin liners. You'll have to ensure that they have sufficient of these spray, these what you call liquids that will, sanitizing the furniture and so forth. So you'll have to give them, not just tell them to go home, and make sure you have Panadol and make sure they have to give them like a package, to ensure that they can go home and continue the treatment at home. But I'm not sure that's being done.
Chief Medical Officer Dr. Narain Singh, in a recent interview with Nightly News, disclosed that persons on home isolation were identified through contact tracing and are asymptomatic. He explained that the ministry currently lacks the capacity to monitor those patients at the hospitals.
The problem is if we were to put all those patients into a facility, we don't have the capacity at this moment, right? And so patients are asked that if they prefer to stay in a facility or at home, right, which is much more comfortable. I mean, nobody likes us being in a facility locked down. So we give them the option is to do home once they can guarantee that well, and then we monitor them, right? You stay away home, avoid family contact with you, and so on.
Deputy Chief Medical Officer Dr. Karen Gordon-Boyle has also stated that before persons are placed in home isolation, an assessment is done at their homes to ensure they have adequate amenities in place to be properly isolated. As of October 20, there were 805 persons in home isolation. Dr. Cummings' position is that in the various regions, private or public buildings should be acquired and designated to house those patients who require home isolation, especially those living in crowded households with high-risk persons.
They'll have to be strategic and to say, well, these are the places. You must have a set of places where you can, apart from the hospitals, some other places, even in the regions where you identify to say, well, this particular house or this particular place we can use as one of our quarantine areas. All right, so that's one. And if in addition to that, there's some home places that it's convenient to that. There's some places that are overcrowding at home. 9 persons, overcrowding, you can get tuberculosis. There are other infections that can lead to other infections. And if you have comorbidities, diabetes, and so forth, you're at risk.
The World Health Organization's new release criteria for asymptomatic patients, which the Ministry of Health is currently following, allows for asymptomatic patients to remain in isolation initially for 10 days. If they are symptom-free by the end of the 10 days, they're given 3 additional days to isolate before being medically cleared of the coronavirus. Temika Rodney reporting for the HGP Nightly News.